Back to talking about ivermectin. In our previous episode, we were discussing whether ivermectin is for horses, for humans, or both. Well, here we are 2 months later, and there is more information that we want to share with you on this episode of Ask Dr. David. Hi, Dr. David.
Hi everybody.
So I want to start off by saying, why did you feel the need to do an update on this issue?
Yeah, so a couple of things. So first of all, I've had some frustration about how the media has been covering ivermectin, and whenever it's spoken about in disparaging terms and as if it was only a veterinary product. Ivermectin has been an approved medication for 40 years for humans. And so, yes, it is also used for veterinary products, but I'll see articles that'll say that it's mainly used for veterinary. And that's just not true. It's used around the world. It won a Nobel Prize in medicine for the people who discovered it. So that's part of my frustration is there's like a very much of a downplaying of something that is a true pharmaceutical agent.
Great.
Also, I do want to clarify that I am providing here unbiased factual information. I'm going to give my take on the end of it, but I also want to be clear that I do not prescribe ivermectin. I am not advocating for people to do it. I am providing information. I also would like to give a shout out to Dr. John Campbell, who is a doctor in England who has been just so spot on during the entire COVID process, somebody who I watch every day. He's had some very interesting and very detailed and thought out comments about ivermectin and the vaccines and everything, but I really appreciate that the way he presents everything, and some of the things I will be talking about today has been things that I've learned from him, and I'm going to apply a more clinical approach to it all.
Great. So I want to move us along and talk about, you mentioned a little bit about ivermectin use currently. And so talk about how ivermectin is currently used as an FDA approved prescription for humans.
Certainly. So this is approved for several different parasites as well as for scabies, which is a skin infection, literally bugs crawling under the skin, something relatively common for children. It's been approved for 40 years now. There have been over 3.5 billion doses given worldwide to humans, not talking about veterinary use. So this is something that is incredibly widely used for decades. And so there is a tremendous amount of experience for it.
And I know that you and I have addressed in other episodes this concept of off-use labeling. Explain what off-use label usage is for an FDA-approved drug and whether or not it has been being used as an off-label drug for the treatment of COVID-19.
So another term for this is being repurposed. There are many times in medicines, and this is something that doctors have the liberty to do, part of our FDA, is that if there's a medicine that's been approved by the FDA, if it's clinically warranted, we are allowed to prescribe it for other uses. An example of this that's commonly talked about is like Pepcid or other types of H2 blockers, which are used for reflux and for gastritis. H2 means histamine 2, and it also has antihistamine purposes against allergies. And I've seen allergists, I've certainly sometimes suggested using it if more histamine control is needed. So that's just one of many examples out there, but it is a very common practice among physicians to safely using the same FDA-approved doses that would be approved for other medications as a way of trying out, to try to clinically help the patient, because that's obviously what our main goal is.
So I know that you're going to go into some of the upcoming research here, and I know that for the information that you're going to be talking about, that a lot of this information says that it's investigational, that the efficacy for the use of ivermectin has not yet been determined for COVID. I also want to say that you mentioned to me earlier that there are no black box warnings for this. What does that mean?
Yes. So medications that the FDA deems to be still approved, but there are significant concerns about the danger in terms of side effects. And these medications will receive what's called a black box warning. And this is something that's supposed to flag a doctor, but kind of make sure that you're okay with doing this. Make sure that you've reviewed everything. Not that we don't review side effects anyways in terms of medications. But I do want to point out there is no black box warning. So over the decades that's being used, this has never been raised as a major concern for safety before until what's happened recently. And of course, I think part of that has to do with the fact that some people are using veterinary products and using the paste, which are obviously very different than a pharmaceutical grade product that's being dosed according to a person's body weight or age, etc. And so that's kind of a big difference here, is that there's never really been a concern about massive safety about this medication before.
So I want to talk a little bit about the dosing of ivermectin as it's approved for the FDA. I know you mentioned earlier that you have not prescribed ivermectin, and I just want to clarify for our audience, do you mean that you have not prescribed ivermectin in the course of your history as a physician, or that you have not prescribed it specifically for use as an off-label for COVID treatment?
Yeah. So I've used it, ivermectin, I've ordered it a few times over the course of the last decade, but this is not something that I'm currently actively ordering for people who have COVID.
Okay, so the next thing that we want to talk about then is current dosing usages of ivermectin when it is being used as FDA recommended or as an off-label.
Yes. So we know that this is being listed by the National Institute of Health by the is something that's considered investigational, okay, which means that they're looking into it. Efficacy has definitely not been shown, but it is something that is being looked into. So the doses that I've been seeing people use for COVID are the same dosing protocols that are being used for the parasites and for the scabies, which is typically like 0.2 milligrams per kilogram. Now, there is a difference in that they're typically done as a single dose when using according to the FDA labeling for those parasites, and what I'm seeing are people doing it for 5 days in a row. Now, so of course, does that mean that the safety at 5 days is going to be just as much as one day? Of course, we don't know that, but understanding the overall picture of ivermectin, as well as from what has been used, and we know that in other countries it has been used extensively, that is a pretty common protocol that I'm seeing being used.
Right.
Now, beyond that, it's also something that has been approved for use in children over 15 kilograms, which is 33 pounds. So we're talking, a 3-year-old typically is around that size. It's also something that's been approved for those types of parasites and scabies types of things. So again, even in young children, this is something that is FDA approved at this type of dosing. The difference is that they'll give a certain number of milligrams based upon a dose range, but at the same time, it is something, again, that has been used extensively in children throughout the world.
Okay, so I know we discussed at the top of the show that there's been a lot of expressed safety concerns regarding this. So I want you to discuss issues of safety in terms of using this as an off-label use for COVID treatment.
Yeah. So in the data that I was able to find, and this is through October, so it wasn't that long ago, that there have been in 2021 about 1,800 reported cases of ivermectin poisoning according to Poison Control. I was only able to find a handful of people who have actually died from overdosing of it. Of course, every life is precious, but there haven't been tons of people who have been dying from the miscorrect using or the overdosing of ivermectin. Now, one of the things I thought was interesting to point out is the safety profile of one of the most commonly used medications in America, which is acetaminophen or brand name Tylenol. And so, as you can see here, there are about 50,000 reports to Poison Control of overdose of acetaminophen or Tylenol every single year, and over 100 deaths per year. It was close to 200 deaths in 2019. Maybe so, in 53,000 total cases, and that's not including combination products that have the acetaminophen plus something else. That's plain old use of acetaminophen only. Now, of course, it's not fair to compare those two numbers straight up, because there's a lot more people who take Tylenol every year than whoever would have taken ivermectin so far in 2021. So I'm just more showing the fact that, there's certainly, we don't hear those types of grave warnings on the news, the types of discussions where people taking Tylenol, of course, people have heard that you can overdose Tylenol, but at the same time, if you look at the types of numbers of what the concerns are, it's an interesting comparison nonetheless.
So I want to talk a little bit about the research that's being done now to answer some of the efficacy and safety questions in the possibility of using ivermectin for COVID treatment. And again, I want to say that for any healthcare providers or physicians out there that may be watching this, part of what we're wanting to do is just open up the discussion to be a broader discussion as to whether or not ivermectin may be a valid treatment for the use of COVID. As Dr. David said, it has not been FDA approved for that purpose, but there is also no black box label prohibiting doctors from potentially exploring this more. And it is happening at larger institutions, respected institutions. So, Dr. David, tell us a little bit about the current research that's going on to answer questions related to efficacy and safety for ivermectin use in COVID.
Yes. And, there have been studies that have been done already. They've been almost, I think all of them have been international studies. So obviously not under the same auspices of the criteria that we need here to have a viable study. But there is currently in America a large study going on that's being done at Duke and Vanderbilt. So certainly two of the more prestigious universities in our country. And in this, what they're doing is they're taking both ivermectin as well as a couple of the other medications that are being used off-label in that repurposing way. Luvox, which is a fluvoxamine, as well as fluticasone, which is an inhaled steroid, and they're comparing each of those to placebo, looking at about 2,500 people get the medicine, 2,500 people get the placebo in each of the three groups, with a target of 15,000 patients being studied. Additionally to that, in the United Kingdom at Oxford, they are undergoing a similar type of trial where they so far have about 7,700 subjects have been recruited. They're comparing ivermectin and an antiviral medication. It's not the Pfizer or the Merck one that we've been talking about here, and comparing those to placebo. Both of these studies are the randomized controlled studies that are considered the gold standard. Now, these experiments are supposed to go on for a while, though. But one of the things that we've seen in other aspects of medicine, and even with COVID, is that if there is a really positive effect, the researchers have a way of getting the information. And if it's such a positive, they can even break the study early. So we know that some people have touted ivermectin as a miracle cure. And of course, we don't have that information, but if a study comes out so positive that they say, oh my gosh, we need to break the seal on this, we need to report it now, then that would obviously tell us that this is a strongly beneficial medication and that the safety of it is certainly appropriate for the usage of it when weighing the risks versus the benefits. So, I would hope that the researchers would take that approach. If it's not, and of course, if it's not, that means that they haven't seen the type of data, because you'll have an institutional review board who looks at the data. The research themselves, they don't see the data because, of course, that would break the randomness of it. But they do have somebody who's able to look and interpret that data to kind of see what's going on as it happens. Or if something terrible is happening, they want to know too, so they don't keep exposing something to somebody terrible.
Right.
Something terrible.
Okay, so I do want to say that we're going to keep talking about this issue. We're going to keep talking about it here on Ask Dr. David, and we'll be doing some other further exploration with other physicians and researchers on our other show, Your Health, Your Choice. So we want to wrap up today's Ask Dr. David episode by just reiterating a few things. Currently, you nor the FDA are prescribing this for use in people for COVID treatment. And if I understand correctly, the jury is still out. But give us some of your other concluding thoughts on ivermectin at this point, which is being recorded in November of 2021.
Yeah. So one of the nice things is that we have now is there is a proposed mechanism of action, in that we actually know that it's that at least in the Petri dish, that ivermectin works as a chymotrypsin-like 3 protease inhibitor. That's a lot of words, but basically what it means is a protease inhibitor means it stops the breaking down of proteins which are needed for the virus to be created. The Pfizer medication that's coming out actually does the same thing. And so, of course, does that mean that it's working in the human body just because it's working in the Petri dish? Of course, that's not necessarily the same thing. Does that mean that we're getting the exact amount into the body that would accomplish that? Again, we don't know. But there is a proposed mechanism of action, which is something that we did not have before. So, obviously, I don't have that type of clinical experience to say it, but at the same time, if you were to say to me, what would I be doing right now if a patient was documented had COVID? Well, I would absolutely first and foremost recommend that person get monoclonal antibodies if they are at any risk whatsoever of getting worsening disease, which of course, kind of for a lot of people, we don't know, and that potential is there. getting the vitamin D and zinc levels optimized. You've heard me say this time again, in the middle of the range, not just barely scraping by. And I do believe that vaccination is a very, very important part of a person stopping, not necessarily from getting sick, because we are seeing those, but we are seeing significant reductions in terms of hospitalizations and deaths of people who have received the vaccine as well. So all of those things are important. And of course, people should be mindful of everything there.
Okay, great. As I said, we're going to be coming back and talking about this. I think it's really important as we move through this pandemic and as we sort of enter whatever this next phase is that we don't yet know about, that we continue to open our minds and have conversations and recognize that all of us are being subjected to information from a variety of sources. And our job here with Dr. David is to kind of peel it apart and try to make sense out of it in a way that is helpful for our viewers. So I do want to remind everybody to stay tuned. And the best way to do that is to subscribe to our YouTube channel below. And we also always encourage you to leave comments about this episode. Feel free to include questions that you would like to hear Dr. David speak about on future episodes. And you can now find us on all types of social media platforms using the handle @PagingDrDavidMD. So we look forward to seeing you again. Thanks so much, Dr. David.
Have a great day, everybody.
Bye-bye now.